with the topic case reports vision loss after myocardial infarction, revascularization. So please give presentation.
Dạ, kính thưa quý chủ tọa đoàn và quý đồng nghiệp, ngày hôm nay tôi rất là vinh dự có mặt tại hội nghị tim mạch miền Trung Tây Nguyên mở rộng lần thứ 11 và có bài trình bày của mình dưới dạng là báo cáo ca lâm sàng. Chủ đề ngày hôm nay đó là mất tầm nhìn sau can thiệp nhồi máu cơ tim. Và tôi xin phép được trình bày bài báo cáo bằng tiếng Anh. Ladies and gentlemen, it's an honor for me to be here and present a presentation as a case report. I am Dr. Khoa from Huế Central Hospital. Today, the topic is visual loss after myocardial infarction revascularization. As you may know, loss of vision or visual loss is considered a sudden if it develops within a few minutes or a couple of days. It may affect one or both eyes and on a part of field of visions. Today, I will go to step by step from case report, an overview, and do we have any suitable strategy? And finally, we will take a home message. The case report. The 64-year-old woman patient presents with acute angina and shortness of breath. The medical history is the diabetes mellitus type 2 with a glucose 1,000 per day milligram and hypertension stage 1. The blood pressure at the hospitalization is 90 per 60. The heart rate is 90 BPM and oxygen saturation is 90%. The ECG show at the ER room is XD segment elevation at V1 to V4, and left ventricle ejection fraction is about 50%. And she was diagnosed with acute myocardial infarction, STEMI, and had an emergency PCI performed 1 hour eupenamation. And this slide showed a video with total occlusion at the proximal of the LAD. And when we put the wire and the balloon into the proximal of the LAD, we can see we don't see any flow at the LAD. And after stenting, the flow of the LAD become more back to normal, TME3. Especially revascularization with a DES stent was performed, but after deploying, the systolic pressure was quickly damping from 90 to 50 and to 30, and ECG show ventricle fibrillation. You may know the condition of the patient become more analogous. And we decide to chest compress and get first defibrillation with intravenous administration of sodium bicarbonate and adrenaline. After a few minutes, approximately about 3 minutes, the ECG become back to sinus tachycardia, and the condition of the patient returned to have a good peripheral pulse, spontaneous respiration, and recovery of responsiveness. And totally, the time of shock condition was less than 3 minutes. You can see the final result of the PCI, this picture, the good result of the LAD with DES stent and the TME3 flow at the LAD. And after the shock of patient, the patient suddenly got visual loss in both two eyes immediately after the procedure. And she couldn't see anything. All her view was black. Her pupils still react to light. The funding were normal. Superficial neurological examination revealed no abnormality. She was transferred to ICU room of my department, emergency cardiovascular department, with a closely monitor. At the first time, I and the relative person of the patient is a little confused because we don't fight, we scare about the many complications. Do I let the rupture of the vessel to the retinal and make a retinal emboly? But after 3 hours of following up, her condition was better with my chest pain, and vision got back to normal. We had a discussion with ophthalmologists, and detailed ophthalmological examination revealed that visual acuity and visual field test on a perimeter and a fundus was on normal. And a discussion between the neurology and interventionist is complete neurological examination and carotid examination was performed and received normal result. CT brain showed no significant abnormality. And we decided to have a diagnosis in this patient is transition cortical blindness. We can see that the etiology of the visual loss is symptom, but the etiology is many reasons cause visual loss. And in the scenario of revascularization of MI patient is a rare complication, and that may caused by some reason, including transition cortical blindness as an expression of cerebral anoxia, and retinal artery occlusion due to thromboembolic events that may happen in the intervention process. And blindness in this case, we probably think about the cerebral anoxia, and they are unusual because blindness was not accompanied by other neurological signs, because everything we examine is no abnormality. And the you may know at the anatomy site, the brain receives its blood supply from the both middle and posterior cerebral arteries. Although this dual blood supply tends to lessen the extent of ischemic damage when only one vessel is occluded, it does not protect this area from damage when there's general hypoxia, for example, cardiac arrest and prolonged hypertension, especially in this patient. And another reason is retinal damage. The incidence of new retinal emboly after revascularization is about 6.3%, according to the code jury at the BMC cardiovascular disorder at 2011. And the risk factor is age, hypertension, or operator expertise. The mode of the procedure and severity of the coronary artery disease had no effect on the risk of retinal emboly. And finally, according to many information about the transition cortical blindness and retinal emboly and some other visual loss complication, we conclude some messages. First, visual loss due to transition cortical blindness is a rare complication post-cardiovascularization with a hemodynamic instability, but have a good prognosis if patient got a good recovery in short period of time. 2. Retinal emboly must be ruled out with a careful discussion between physician and ophthalmologist. And neurologist as well. The shorter time of getting back to recovery after revascularization of myocardial infarction patient. For example, we have a good CPR, we have a good ACLS, intravenous, put the vein, shock, defibrillation, everything. We take the condition of the patient back very quick, the better outcome of application. And the patient will get back to normal very soon. Thank you for listening.
Very thank you about your presentation. It's very interesting case and rare case, and you present is very clearly. So we have two questions from Professor Nguyen, and you answer very shortly. The first is how much contrast did she receive? The second question is how long were the time of angiography and stenting? So please answer very briefly.
Thank you about the question of Dr. Nguyen and the jury. In my case, the time of the revascularization is just about 30 minutes, and the amount of the contract agent is about 100 milliliters. I know that the transient cortical blindness is a rare complication that may relate it to an angiographic contract agent, and I don't have any proof to prove that the angiographic contract agent rule out in this case. So the angiographic contract agent may be one of the reasons why patients have the transition cortical blindness in this patient.